Oh, we're live already without the countdown. Yes. So welcome, Siobhan, and we are not going to be on Instagram today because I didn't go and hit the Instagram thing. And anyway, welcome and thank you for being here with me today. And I am hoping that you'll be able to tell us about the very exciting upcoming baby shower that's due to happen on the 19th.
Yes, thank you so much for having me and allowing me the opportunity to share. We are really excited to host another annual baby shower to welcome new babies into the world and celebrate our pregnant moms. The event, you're correct, is going to be this upcoming and actually next Saturday, July 19th, here at the VA Maryland Healthcare System on the second floor where our women's health clinic is. So we are excited because we are going to be able to also host vendors. So vendors both that are VA related. So women's health, of course, will have a table there, our physical medicine and rehab, because we partner very closely to help support our pregnant veterans. But we also have some amazing community participants with birth companions from Johns Hopkins University. We have birth doulas that will participate, and we're super excited to hopefully also have WIC and healthy babies participating with us as well.
So back up a little bit. What's a birth companion?
So a birth companion, in essence, sometimes can be used as a doula. So if someone doesn't have someone to be there at their bedside with them, then their birth companion can help. They're often the ones that are advocating for them, will follow a mom to be's birthing plan and ensure that everyone that's in the room helping to support the safe delivery also follows the birthing plan appropriately. But sometimes, especially with us having vets, and a lot of our couples may still have someone that is actively serving in the military. So maybe that person cannot be there. And so having someone else be able that they trust to be in the room bedside with them is a lot. And so that's part of some of the services that they'll be able to talk about and discuss how they can help and support.
So does the VA support the birth companions for veterans who are expectant moms?
So it's a community based program that is free to anyone. So we are very much in support of any additional community collaboration and partnership. So, unlike some of our other benefits where it has to go through a care in the community consult process to have that collaboration, this doesn't need it. It's a free service that provides the resources and benefits that's grant work through that university.
That is amazing. That's something definitely new, having a birth companion. And I would imagine for those veterans whose partners are still deployed, it's a real comfort knowing that they're not going to be alone in the process, especially if they are living someplace that is far away from family and friends. Because I know a lot of veterans who end up in Maryland have done so because this was their either final deployment station and they stuck around. So talk a
Yeah.
little bit about the shower. Like, what can expected and new moms expect that day when they're here? Like, is there going to be shower games? Will there be food, gifts? Can you talk a little bit about that?
I can. We have a full-fledged agenda, so to speak, with them, but still kind of keeping it loose for them to have some fun. So we've already talked about the vendors. There will be a sit-down lunch where they get to interact with their other veterans. During that lunchtime, we will also play a few games. What's a baby shower without games? So we'll play a few games with them, but they also can expect some goodies, which is the nice part where we get to give back and say thank you. So outside of the food and the cake, because what's a baby shower without a list, a little something sweet to kind of top things off with, we will provide a number of available resources and goodies for mom. So there will be a mom bag because mom needs to have her own swag also, which will be gifts exclusively for mom. But then there will be a host of other gifts to welcome new babies. So baby essentials, so diapers, wipes, baby lotion, and powder. They will be able to walk away with one larger item, whether that be a crib or a car seat or a bouncer or a park, a plaque and play. A lot of our partner organizations were very generous in their donations to be able to help support this event, which we truly appreciate. They'll also have a bag with like little baby goodies in it. So onesies, maybe a little outfit, a blanket, bib, things like that. So we are very much appreciative of all of the support that we've gotten and all of the items that have been donated. There were a few items that we had to shop for, but that was what makes it fun. They'll have time to interact with our vendors that are coming in and at the tables, but they'll also have time to talk with many of the specialists that they work together with. So, like I mentioned, our maternity care coordinator will be there, the Women Veterans Program Manager, myself will be there. Our physical medicine and rehab team will be there to talk about how physical therapy or occupational therapy can support their pregnancy. Our intimate partner violence team will be there as well. So if they need guidance, support, or resources, we have a whole host of team members that's going to be made available to help support their journey and ensure that they have what's needed.
So, how does the veterans who are expecting and new moms, how do they get invited to be part of the shower? Can you talk about that process a little bit?
I can. It's like the best time that we have and the most fun that we have doing this. So for every new pregnancy alert, that means that a veteran tests positive, whether it be with blood work or with a urine pregnancy test that's been done here at the VA, there's an alert that goes into their chart. And that alert generates a list where we send our invites out exclusively for that list. So a veteran definitely has to be enrolled into our VA Maryland healthcare system. And then we go off of the pregnancy alerts. Our goal is to include veterans that are currently pregnant. Now, some of our veterans may have participated in previous baby showers or sometimes are in that in-between state. Because of the generosity of our community support and our VSO organizations, we do at times get additional supplies where if you're caught in that in-between, you still get a nice little gift for us that we send out. So someone may become pregnant after our baby shower event and may end up delivering before we have our next baby shower event. But we do take the opportunity to still package up a nice little gift and send out to them. Just our way of supporting and still saying thank you and that we're appreciative for everything that they have and that we are together celebrating this amazing bundle of joy that they're going to bring into the world in 9 months.
Well, it sounds like it's going to be a very fun event on next Saturday on the 19th. And is there anything that you want expectant and new mothers who are veterans who may not be enrolled in VA healthcare? How can they get involved with VA Women's Veterans Health?
So the first thing that they would have to do if they haven't done anything is they would start with our Veteran Benefits Association because you need to go through the benefit office to be able to start with that. And that's the Veteran Benefits Administration, where you are going to take all of your charts and your paperwork. So your DD-214, that discharge paperwork, so they can review everything with you and then determine your eligibility. Once that process is done, then you get to come over to us at the VA Maryland Healthcare System, where you would start out with our enrollment team. Our enrollment team is located on the first floor here if you would like to come in person. If for some reason you cannot come in person to the enrollment team, because sometimes that happens, you just can't come on campus for whatever reasons, they do take phone calls and they are very much able to get you connected with services through the phone call as well and get you enrolled into VA healthcare and also to get you signed up to needed healthcare services. So that phone number for enrollment, if anyone needed it, is 410-605-7000. And then you would dial extension 57324. So that's the department that helps get you enrolled. And what I love about that department also is at times they can also help initially with appointments. If they are not able to help schedule your first appointment, then the phone number after you are enrolled to get scheduled within the Women's Health Clinic is 410-605-7000. And then you're going to dial extension 54981. And that's directly to the Women's Health Clinic, where we can get you coupled with a comprehensive women's healthcare provider and seen for your healthcare needs.
So, what are, in a nutshell, some of the benefits that women veterans can get by being involved in VA healthcare, aside from a baby shower, which is very unexpected?
Yes. So outside of the baby shower, they get comprehensive women's health care. And you'll hear that term used so often because we're emphasizing the fact that there is one provider that can provide all of your healthcare needs. So sometimes when women are seen in the community, they have a primary care provider and then they see an OBGYN provider for what we call your well woman needs. So that's your pap smears or whether or not you need to get your mammogram, your breast cancer screening. Here within the VA Maryland healthcare system, that comprehensive women's healthcare provider is going to act as that GYN and also your PCP all within one doctor. So all of your care is housed there. Now, we also follow a very comprehensive model here. So if for some reason you have social needs, then there is what we call a packed social worker that is assigned to that same team with that provider that is able to help support social needs. If you have questions or concerns regarding mental health, there is a mental health champion that is integrated within that women's health clinic and team that are also able to assist as well. So we really do provide comprehensive women's health care. But then the team in itself has additional partners that work together with them because there are needs outside of just social needs or mental health needs, as well as just primary care. Maybe you have questions about your medications. We have a women's health pharmacist that works together with our team that's able to review medications with you, answer any questions that you may have. If you think for some reason you might be taking too many medications, you can sit down and have a comprehensive reconciliation with the pharmacist to kind of go over that information with you. If you have pelvic floor concerns, urinary incontinence, we have a women's health pelvic floor physical therapist that's a part of our team that are able to provide additional services. We have two clinics for menopause care. One is coupled within our GYN team, so that is ran by our gynecologists, which are specialists here at the VA Maryland healthcare system. But the other menopause clinic is done by our pharmacy. So if you've been prescribed medications, you feel those medications aren't working well for you, and you have questions and concerns, the pharmacist is then able to answer any of those questions for you. And then they have the advocate and myself. So I very much take and we expand our program based on the feedback that we hear from our women veterans. So if there is something that we're not providing access to and you need access, that's where they get to have a conversation with me so that we can talk about what's needed and how we can go about continuing to grow our program and bring in those needed resources. That's kind of how we got our pelvic floor physical therapist. It's also how we got our women's health, mental health champion, and other team members that are on the team, like our cervical and breast care coordinators that also work together for our women veterans care needs.
So if you're a woman veteran out there and you're not yet enrolled in VA healthcare, you don't know what you're missing. And I also understand that VA actually supports the prenatal care that expected women veterans receive elsewhere. Is that correct?
We do. We do. So when you are enrolled with us, because we do not offer labor and delivery and obstetrical care within our VA walls, that's where we partner with our providers in the community. So it is still a covered medical benefit, but you get to see a provider of your choice in the community that is partnered and accepts our insurance. We still allow you to follow with our team though, because there are benefits that you still have, like your breast pump, if you need nipple cream, your prenatal vitamins, that all may be covered and you need to get that from the VA, but you're seeing a doctor in the community. So that's where our maternity care team come into play to ensure that we are ensuring that our women veterans are still able to get their VA benefits while even still being in the community. And we're very unique here within our walls also because most postpartum patients are either covered through 6 to 8 weeks. That's the time that it takes to recover after the type of delivery you have. 6 weeks if it's a vaginal delivery, usually about 8 to 10 weeks if it's a cesarean section. However, our maternity care team here covers all of our our postpartum veterans 12 months. So we cover you for a whole year to make sure that we are not missing anything that may be integral that you need in terms of help, support, collaboration with mental health, social needs, etc. We want to make sure that we're keeping a close eye. As we know, maternal mortality is at a very increased rate nationwide, especially with certain populations, those populations being Black and Indigenous people of color. And so we want to make sure that we do our part to ensure that we are protecting the maternal health of all of our pregnant women. Right now, we've had a 0% in our maternal mortality rates here within our VA Maryland healthcare system.
Wonderful news. And one final question. Right now, this year's shower is all done. It's all, ready, and where everything's ready to go next Saturday. So in
Mhm.
the future, if someone, a veteran or maybe a non-veteran, a community member, if they want to be involved with the baby shower for next year, like let's
Yeah.
say they want to be donate items, or they
Mhm.
want to be a volunteer during the event, how do they go about doing that? How can they, or let's say they just want to send money, they don't have time to be part of the shower, but they want to send money, how can they do that?
I would say the best start is to reach out to me directly. So that's the most easiest way. So I'm not passing you through multiple hands. The easiest way is to reach out to myself, Dr. Siobhan Kirksey. I can be reached at 410 605 7275. I am always looking to collaborate with partners. I feel like the collaboration and the partnership that we build together is beneficial. When our community sponsors or volunteers or any organization chooses to donate or spend time with us, I in turn return that favor by providing resources. Our veterans are everywhere in the community, and sometimes they don't often get to come to a number of the events that we are sponsoring. So outside of me, collaborating with veteran organizations, I am always looking for an opportunity to come out and speak and provide resources and information for folks that may not be affiliated with a veteran organization, because our women veterans are everywhere and we have to try to reach them at every opportunity that we get. And so I pride myself on making sure that I collaborate with many across the community to make sure that, one, they know of the resources that's available, because that's the most empowering thing, is passing that knowledge and information along. But two, us often working together, because you get to build and learn a little bit more when you work together.
Thank you so much, Shaban, for this bird's eye view of our annual baby shower, which is happening next week. Women veterans out there, if you're not yet enrolled, you could scroll back and watch this to get the numbers. For some reason, it's not allowing me to post the numbers as a comment, but I can do that after the show is done. Thank you all for watching. And if you have any questions about how to get involved in the baby shower next year, how to donate, how to become a vendor, definitely do. Please reach out to Dr. Kirksey here. And thank you all for watching. And I want to remind you to smash the like and follow button. And so this way you can get a heads up for when our next stream appears. Thank you
Yeah.
all. Bye
Thank you
bye.
guys so much. Bye, everyone.